Hi everyone, welcome back to Pregnancy to Parenthood. Today, we're covering a sensitive yet important topic: miscarriage. Our goal is to provide you with clear, accurate information about the types of miscarriage, possible causes, and steps you can take to reduce your risk. Remember, miscarriage can be a deeply personal experience, and each situation is unique. So if you're watching this, please take things at your own pace. To start, let's define what we mean by miscarriage. A miscarriage is the spontaneous loss of a pregnancy before the 20th week. Sadly, it's more common than many realize, affecting about 10 to 20% of known pregnancies. Most miscarriages occur in the first trimester, often due to chromosomal abnormalities, and they're usually outside of anyone's control. Still, understanding the types of miscarriage can help in managing expectations and knowing what to discuss with a healthcare provider. A threatened miscarriage means there are signs that miscarriage could happen, like light bleeding or abdominal pain, but the pregnancy may still progress normally. The cervix remains closed during a threatened miscarriage, which is a positive sign. In many cases, with rest and medical support, the pregnancy continues without further complications. Rest as much as possible if you notice any spotting. Avoid strenuous activities and heavy lifting. Stay hydrated and monitor symptoms closely, contacting your doctor if anything worsens. A complete miscarriage means that all pregnancy tissue has been expelled from the uterus. This typically occurs very early on, and symptoms may include heavy bleeding and cramping, which usually subside as the uterus empties. While complete miscarriages are often caused by chromosomal issues, maintaining a healthy lifestyle and managing any chronic health conditions can improve future pregnancy outcomes. An incomplete miscarriage happens when some pregnancy tissue remains in the uterus. This usually requires medical intervention to prevent complications like infection. Doctors may recommend medications to help pass the remaining tissue, or in some cases, a minor procedure to remove it safely. If you experience prolonged bleeding, pain, or other symptoms, seek medical attention to ensure complete recovery. A missed miscarriage occurs when the fetus has stopped developing, but the body hasn't recognized the loss yet, so there are no symptoms. You might only find out during a routine ultrasound. This type can be particularly challenging emotionally, as it often comes as a surprise. Regular prenatal checkups are essential to monitor the baby's growth and development. If you have risk factors, such as a history of miscarriage, your doctor may suggest more frequent checkups or specific blood tests. Recurrent miscarriage refers to 3 or more consecutive miscarriages. While this is rare, it can be especially painful. The causes vary and may include genetic factors, hormonal imbalances, or structural issues in the uterus. Testing and working closely with a healthcare provider can often identify the underlying cause, leading to treatment options and improved outcomes in future pregnancies. After a recurrent miscarriage, consider seeing a fertility specialist to explore potential treatments. Tests like genetic screening or hormone level assessments can provide valuable insights. An ectopic pregnancy occurs when the fertilized egg implants outside the uterus, usually in a fallopian tube. It's a life-threatening condition for the mother and cannot result in a viable pregnancy. Symptoms may include sharp pain, heavy bleeding, or dizziness. If you experience these, it's essential to seek emergency care. Early prenatal care can help detect an ectopic pregnancy sooner, often through blood tests and early ultrasounds. Reducing risk factors, such as avoiding smoking and managing infections, can slightly lower the risk of an ectopic pregnancy. Now let's look at some general factors that may increase the risk of miscarriage and what you can do to reduce them. The most common cause, but one that's largely outside of anyone's control. These abnormalities usually occur randomly and may not repeat in subsequent pregnancies. Smoking, alcohol, and drug use during pregnancy increase the risk. Avoiding these substances is critical for a healthy pregnancy. Women over 35 have a higher risk due to natural aging of the eggs. While age is beyond control, being proactive about health and monitoring pregnancy closely with your doctor can make a difference. Chronic conditions like diabetes, thyroid disorders, and high blood pressure increase miscarriage risk. Working with your doctor to manage these before conceiving is a great preventive step. Certain infections like rubella or sexually transmitted infections can impact pregnancy. Make sure you're up to date on vaccinations and seek prompt treatment for any infections. Finally, let's talk about emotional well-being. Experiencing miscarriage can bring a flood of emotions, from sadness and anger to confusion and even guilt. These feelings are normal. If you've experienced a loss, remember that it's okay to grieve in your own way, and consider reaching out to supportive resources like therapy, support groups, or family. In summary, miscarriage is a complex and deeply personal experience that can happen for various reasons, most of which are beyond your control. However, leading a healthy lifestyle, staying proactive with prenatal care, and addressing any known health conditions can reduce the risk in future pregnancies. If you found this information helpful, please like, subscribe, and comment below if you'd like to share or have questions. At Pregnancy to Parenthood, our goal is to support you through every step, from preparing for pregnancy to welcoming your baby into the world. Thank you for watching, and remember, you're never alone on this journey.